How have bone cancer biopsy procedures evolved historically? Imagine a time when diagnosing bone cancer meant making large cuts into the bone itself. That was the reality in the early days, when open surgical biopsies were the main method. These procedures involved big incisions to remove part of the tumor or bone, providing plenty of tissue for diagnosis. But they also carried risks like infection, bleeding, fractures, and even spreading tumor cells locally. Imaging guidance was limited, so surgeons relied on their experience to decide where to cut, often leading to less precise results. As medical technology advanced, so did biopsy techniques. In the mid-20th century, the development of frozen section analysis allowed pathologists to examine tissue samples during surgery. This meant surgeons could get immediate feedback on whether they had enough tumor tissue or if they needed to adjust their approach. It helped make surgeries more conservative and better planned, reducing some risks. The biggest shift came in the late 1960s and early 1970s with the introduction of core or tree-fine biopsies. Instead of large open procedures, doctors began using hollow needles to extract a solid cylinder of tissue. This method was less invasive, safer, and provided high-quality samples for detailed analysis. It became the standard for diagnosing bone cancers and assessing how much the disease had spread. More recently, imaging techniques like computed tomography scans and magnetic resonance imaging have transformed biopsy procedures. These tools help doctors precisely guide needles into the exact spot of the tumor, reducing tissue damage and improving the quality of the sample. Some devices originally designed for emergency vascular access have been adapted to make bone biopsies quicker and more comfortable for patients. This means less pain, fewer complications, and faster recovery. In some cases, if needle biopsies do not give clear results or if a larger tissue sample is needed, doctors perform incisional biopsies. These are carefully planned procedures that aim to minimize contamination and preserve limb function. Often, they are aligned with future surgical plans to reduce risks. Overall, the evolution of bone cancer biopsy procedures reflects a clear trend toward less invasive, more accurate, and safer methods. Advances in imaging, surgical tools, and pathology have all played a role in improving diagnosis and treatment planning. Today, these innovations help doctors better understand each patient's disease, leading to more personalized and effective care. Remember, always consult healthcare professionals for individual advice and treatment options.